Well, we're so excited you're here today and all this great turnout. I also want to thank the men who came tonight to help balance out this energy, even though you're working. Thank you for being here. Anyhow, I was giving thought about what to say and talk to tonight. And surgeons, we tend to be warrior type personalities. You know, famous psychologist Jung looked at basic personality types, and one of them, you know, personality is a complex thing, but one of the simplifications is that there's this warrior personality. And we go to war every day in the battle against breast cancer. And so do medical doctors as well. We're fighting disease. And anybody who's faced a challenge or had a family member who faced a challenge, you've been at war and you know what I'm talking about. So I thought that was a good analogy to use here. So where did the art of war come from? This was Sun Tzu. He was Chinese. He lived about 2,000 years ago. And what's really interesting is he wrote a treatise about a strategy, about how to wage war. And it still is valid today. Very wise, ancient words from this gentleman, this depiction of him. So here he is. He was a military philosopher. And he's given credit. Who really knows, you know, through the years, who really added to it. This is an old bamboo depiction of the art of war with the Chinese characters, and it's in pretty good shape. So the one thing that he said that really struck me was that the supreme warrior never has to enter into battle. That's really the ultimate goal. Now, wish that were so, because many of you in this audience have been in the battle for yourselves or with other loved ones. And it would be nice to be in a world where I was out of business. And we didn't need this. We didn't need a radiologist and our other colleagues to treat this disease. So my goals tonight are I want to teach you about the enemy so that you can understand it. And in doing so, maybe it will hold less power over you once you understand it. Hold your enemy closer, that old saying goes. So he said, the supreme excellence is not to win 100 victories and 100 battles. You'd be exhausted doing that. The real skill is to subdue the armies of your enemies without even having to fight them, even have to engage them. So what he said, the very first thing you should do are 5 things. We're going to assess the situation with our enemy. We're going to look at the way, the terrain, the weather, the leadership, and the discipline. And I'm going to make an analogy to our cause here. The way means you have to be united. The leadership has to be into the same mindset of the people. And I would dare say something brought you here tonight for some reason. You want to learn something. There's something you need or wanted to get to take your precious time out at night to come back here and hear what I had to say. So my goal is that I meet that need, and if I don't do so in the talk, I'm going to stay until I do that, and you can talk to me personally afterwards, and I want to hear why you came and make sure I met that need. But anyhow, can we agree that we're on the same page? I think that's pretty easy that we can do that, but I just want to tell you a little bit about my motivation and where I came from. My origin comes from the coal regions of Pennsylvania. That's where my family emigrated to on both my mother and my father's side. And these people were in the peasantry in Europe, and they didn't have any hope for advancement. They could basically work themselves to death, never own land, never call anything their own, never give anything to the next generations. So they took a risk and got themselves here, risked life and limb, and somehow made it. And they made their way to the coal mines of Pennsylvania. And that's what life was like. And if you've ever had occasion to go up into the Poconos, you can actually visit. It's considered a working mine to make sure it's safe, but you can go down 2 miles into the earth. And when they shut the lights off and you see and experience total darkness, you can understand the life that these people led and what, you know, sacrifices they gave so the next generation could look better. My parents, you know, worked hard, but they had a meal every day. That was the goal of my grandparents. My generation, we were the first ones to go to college. And so I dare say, I think they are smiling at what they did, and I thank them every day for the sacrifices. Now, I have to mention this woman in the middle. Doylestown Hospital is a hospital founded by women. Back at the turn of the century, Doylestown was the seat, the county seat. And a lot of traffic came through, and especially in the summertime, all the dust kicked up and people would just throw their trash, and people were getting sick. And the women watched this, and they watched it, and then they said, all right, that's enough. And they went around door to door, and they collected enough money to get a water truck. And they would sprinkle the dirt roads down, and that one simple, elegant thing changed the health of the entire community, and that's what we're founded on here. This woman is Anna. She's my maternal great-grandmother. So her husband came to Pennsylvania, saved up enough money, and sent for her 6 months later. On the way over, before she arrived at Ellis Island, he was killed in a mine collapse. She was pregnant with their first child, Nick, who is on her right, your left. She made her way to the little town of Shepton, Pennsylvania, to find out that her husband was killed. So out of necessity, she did meet an unmarried young single man and married him and did grow to love him and had my grandfather on the left, Joseph, and 5 girls. Now, it turned out that the doctor in this town was an alcoholic, and he was pretty much useless. He didn't help the people. Well, Anna was trained in midwifery. She knew how to deliver babies. She knew the herbal medicine, and she quickly became the healer in the town, including sewing people up from fights or altercations that the men would get into. She delivered triplet girls, premature. She put them under the coal stove as an incubator. They all survived, and my family still hears from their descendants to this day. So that's where I came from. I also watched a lot of the men die and succumb to cancer or black lung, and that was a miserable thing. So anyhow, so the next thing, we're in agreement about the way that we're sick of this. I'm sick of seeing cancer. I wish I was out of business, and that's my ultimate goal, to see that sometime in my lifetime. The next thing Sun Tzu said was, you have to know the terrain. It would be foolish to enter into any war or engage in any conflict and not know what you were walking into, or their rivers, or their hills, or their mountains. What are we going to deal with? And it's important to know that. So in terms of cancer, we have to understand what it is. What is the definition? What is this thing that we all fear? And that just raises a lot of deep feelings when you hear that. Cancer is not one disease, but it's a group of diseases. And what it holds is, it's basically abnormal growth of our cells. We have building blocks in all of our organs and cells. And we need them to grow from the time we develop as a fetus into a child, and we keep growing. So we need that ability. But when that becomes disarmed, or it becomes uncontrolled growth, that's when harm can occur. The additional thing, now there are benign growths, benign tumors that grow, but they don't have the ability to invade into other organs. Cancer cells do. The other thing cancer cells can do, now they can break off. They can develop the ability to spread past the point where they first started and harm other vital organs, and that can be a cause or a reason for death occurring. The other thing that's interesting about them, there's a normal cycle of life, that they talk about, that our cells grow, divide, replace themselves, but then they die. It's their time to go, just like the cycle of life. Cancer cells aren't like that. They're immortal. They don't die. So they keep piling up and taking over. But these are various areas of attack that medicine has designed, to overcome the enemy. So this is basic science 101, but just to remember our terminology, we're made basically of cells. Most of them still contain a nucleus, a central area where the genetic material is. And that genetic material is DNA. It contains sugars and some other protein-like substances. That's the best way to put it. But it's the helix, it's the double ladder. And this codes for everything. This determines who we are, what we make in our bodies. All the proteins and chemicals come off of this blueprint. Now, what happens with cancer, all cancer is genetic damage. That material gets damaged somehow. A rung of the ladder can be removed. You can take a piece of the ladder and flip it. It can be removed, and it can be stuck down at another end of the ladder. But what it does is, the way the chemicals come off of it, has to be in a precise order. Well, now you've ruined the order, and the product that you make is going to be deficient. It's not going to function and do what it needs to do. So genetic damage occurs, and amazingly, the body has a great ability to stop cancer. When you really study it deeply, it's amazing that cancer can even establish itself. But I'll explain reasons for why it's tricky, and it evades our ability. So just because it has genetic damage doesn't mean it can go on and harm us, because not all these cells are going to live. Our body's going to detect it and kill it. Then there's more damage that it incurs, and now it can continue to grow. But finally, and our body, is effective in killing this. Finally, though, there can be a mutation that finally occurs. This is an evolution. This thing is almost like a living organism. That's why certain treatments may be effective at first. They say, oh, this person's in remission, there's no signs of disease. Well, why does it come back? Because this is happening. It evolves and it gets better, just like a colony of ants. You may kill 90% of them with the first insecticide, but those 90 are left to keep growing and reproducing. You hit them with the second insecticide, there's still some living. And the ones that remain are the strongest. And now we have that uncontrolled growth, and then we're in trouble. The breast, we have to understand the terrain of the breast. Now, the breast is a modified sweat gland. Its function is to nourish a child, but it is the only organ in the body that continues to develop once we're born. Once we're born, we contain all the eggs as females and all the sperm as males that we're ever going to have. And not to say that can't be damaged, but rapidly growing, developing material or an organ is very prone to environmental influences. Plus, it contains a lot of fatty tissue, and fats store a lot of chemicals. That's why they noticed women with breast cancer had high levels of pesticides, DDT, DDD, that are now banned for various obvious reasons. They're carcinogenic. But they get deposited and they're held there. Our body doesn't clear them. So that's just sitting there, in the environment, in our terrain. I do want to just briefly speak about this and set up my colleague, Dr. Kopach, who's going to talk to us more in detail about this. What we've come to realize, too, we inherit what our breast terrain looks like. It may be all soft and fatty, or there may be some denser, thicker tissue to it. Most of that's genetic, some of it's environmental. We've now come to realize that breast density is an independent risk factor for the development of breast cancer. It's linked with some breast cancer genes. This woman in her village, she's Nancy Capello, she's a PhD and a mother, who I believe it was in 2001 or 2, had a normal mammogram in March. 3 months later, she felt a lump in her breast. She had stage 3 breast cancer. She's still alive and well, but she thought, how could this happen? First point I want to make about that is we want to see patients and give them a good exam before we send you for your mammograms. I know it's easy to call the office, get a mammogram slip, and then go in, but life gets busy and you may not. We can't rely solely on mammography. It's our best screening tool, but also you have to combine that with an examination. If you have something that the practitioner feels, then in addition to sending you for the mammogram, now we'll make it diagnostic, we'll add an ultrasound or whatever is appropriate to work up that problem. That way we won't miss anything. So just bear that in mind. But in addition, she is an advocate and has a whole group, advocacy group. And she's responsible. She lives in Connecticut, worked in Connecticut, and they were the first state to pass breast density legislation where you had to inform your patients as to the level of their breast density. And that's why you're getting a letter this year, and Dr. Kopach's going to go over that. Okay, so that's the terrain. Now you understand what cancer is, what happens, and why the breast is a little bit more vulnerable. The weather is what's out in the environment. Okay, now in ancient times, if you didn't take the weather into consideration and you sent your soldiers out, in the middle of winter, they could become frostbitten, they could become sick and ill. So we really need to know the weather, what's going on. Sick and ill. So we really need to know the weather, what's going on. sick and ill. So we really need to know the weather, what's going on. Sick and ill. So we really need to know the weather. 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 included in here. That does make some factors that protect us. The bone marrow. And these are a lot of potential enemies that could attack our body, but our body has evolved very elegant, distinct systems to fight these off. But first of all, it has to recognize it as something foreign. Is it our own bodies, or is it foreign? We don't want to attack ourselves. If we do, then we've got an autoimmune disease. There's something gone awry where our body doesn't recognize itself anymore and starts attacking itself. And that's why you have the form of diseases, but carcinogens are noted up here as well. So the main defender that we have against cancer is something called a T cell. It's a very specialized white blood cell. And this looks like a scene out of The Matrix, if anybody's seen that movie. But this is a cancer cell, and these are the T cells. Now, in order for them to realize or recognize that this is foreign, it only can look at the outside coat. And so cancer cells have to somehow express something that's foreign to our body, some protein that's coated on the outside. Once that's done and we recognize it, then we can coat it with antigens and send cells in to kill it. Now, here's how cancer can still develop in spite of that. First of all, breast cancer starts out as one of our normal cells. So at first, even when it first experiences genetic damage, it hasn't changed on the outside yet. So it's not yet viewed as foreign. This kind of gives it a heads up. So it can start growing until the body goes, oh, we got a problem here, and we have to send someone out. Now, the effect of stress, that's something else in our environment that's a hot topic. What was noticed was caretakers of people, especially who had a cancer challenge or other health challenges. Those caretakers had a higher cancer rate than other matched people. So there was something going on about the stress state. What does the stress state do? It releases chemicals in our bodies, epinephrine, cortisol, you've heard of that. That depresses the T cells. So it downs our immune system, and therefore, cancer can sneak in. Also, stress could result in behaviors. If you have, you're under a lot of stress and all of a sudden you start smoking a lot again, or you start drinking a lot, that could contribute to it. So again, a hot topic of research. Now here's another thing we did. We started selecting out varieties that were sweeter, or they lasted longer in the shelf life. Okay, they made more money, they didn't, deteriorate as soon. The problem with that is we selected out the good chemicals that are cancer protective. It turns out in a lot of the fruits and vegetables, there's a lot of steroid molecules that are cancer protective. They help repair the genetic damage. Now the plants didn't evolve this to help us. The plants evolved it to fight fungus, because a fungus is very close to a human cell. That's why if somebody gets a fungal infection, it can be really tricky to treat, because if you really gave it killing medicine, you'd harm yourself. So we have to walk a balance with that. So what did farmers do? We spray fungicide on the plants. Well, then the plants didn't have the need to make those chemicals. They're going to conserve their energy. Nature has a plan, and it's going to try to be as efficient as possible. But we've made our food worse. It's not as helpful. The number of servings that you'd have to eat of food produced in that way is probably 4 or 5 times what we would have had to have eaten in the 1940s and 50s. So we've kind of done this to ourselves a little bit. The cruciferous vegetables, again, have all different kinds of chemicals that fight cancer in different ways. And these are some of the names, just in case you hear any of them. Now, a lot of people try to market on this and try to, I think, basically use emotions and say you need this supplement, and look, we're making this supplement. Just be careful. We don't have a lot of studies yet saying, okay, if you take this supplement, this is going to lower cancer rates. We'd have to do that in a population-based study. Somebody noticed that people who took vitamin A might have been protected from one type of cancer, but if you were a smoker, there were higher rates of lung cancer with that. And that was also true of a selenium study with prostate. They gave selenium supplementation thinking that was going to decrease prostate cancer rates, and it did the opposite. So. All right, so finally, this is Sun Tzu, and he's ready for battle. But his sword isn't drawn. What he's got outright in his hand is that bamboo treatise of his art of war. So what I would say to all of you, we have to be warriors for ourselves and our families. Educate yourselves. Think about what I've said, about what you can do to protect yourself. Now, I want to especially say to the survivors, you did nothing wrong. Okay? You didn't do anything to deserve this. If you had eaten a few more vegetables, would it not have happened? That's not serving, and that's not the point of this. But I had a survivor say to me in another talk this year, we're made to feel that we did something wrong. Could you try to understand why it happened? That's just natural. What did I do? Or is there anything I can do to protect myself here forward? Well, clearly there's a lot of behavioral things you can do. Your alcohol exposure, you have control over. Your smoke exposure, you have control over. The amount of exercise, whether you keep on top of your body weight. Women who have been treated for breast cancer, singularly, the thing that is most protective for them is maintaining a lower body weight, because our fat cells still transform a hormone into estrogen, and that increases our risk. So there's a lot of things we can do. I don't want you to feel that you're just lying in wait for something else to happen. That doesn't have to happen. Be mindful of what kind of food you're buying. And I say that to myself, can I afford to buy organic all the time? Probably not. But if I'm getting 4 to 5 times the value in an organic box of raspberries that cost twice as much as the non-organic ones, and I just look at them and I can tell by the color, this is better, I think I'm going to invest in that. The fruits with very thin skins have high pesticide rates in them unless they're organic. And some of these pesticides are listed on the carcinogen list. Interestingly enough, you could blast an avocado with dioxane and it doesn't absorb it because it's a thicker skin. So if you want to make a decision in the supermarket, try to lean towards healthier thin skin fruits and try to increase your servings that you intake. All right, and so that's where I want to stop at this point and turn the speaker over to my colleagues.
Thank you. Thank you all for coming. So if she describes herself as a warrior, I would say I am a seeker. I am a radiologist. And what we do is look for things. So we read the mammograms, ultrasound, MRI, and we are looking for breast cancer. So what is breast density? Why am I mentioning it? Why is anybody interested? Until recently, breast density is a term that I would only really discuss with other physicians. It's not that it's something that's new or that we've never actually talked about, but it's not something that was out in the standard population. It's not a term that you walked around and talked to your friends about. Oops. So what is breast density? Your breast tissue is made up of lobules, ducts, fibrous, and fatty tissue. Everyone has the lobules and ducts, fibrous tissue, and fatty tissue, but it depends on the balance of what you have. And that is predominantly genetic, but also age-related. The more fibrous tissue you have, that would be considered a dense breast, whereas the more fatty tissue you have, that would be considered a less dense breast. This, however, is not related to BMI. So if you are told that you have almost completely fatty tissue, this does not mean that we are considering that you are a fat person. It's not related to that at all. Some people who are very thin would have fatty tissue, and you could be very thick, very heavy, and have dense breast tissue. Not related in any way. So, is this something new? Is this something that was out there forever? No. This is something that the woman in Connecticut discovered because she found a breast cancer, and she felt that if she knew that her breast tissue was dense and that the mammogram was limited, she would have sought out additional testing, and perhaps it would have been found earlier. We don't know if that would have actually happened for her or not, but she felt that that was important. So she made it her mission to get all 50 states to pass a law so that patients could know what their breast density is. And that's where this came from. So what are the categories? The American College of Radiology has had categories like this. They used to be 1, 2, 3, 4, but that was confusing because we have other things that are labeled 1, 2, 3, 4. And so we now categorize it with A, B, C, and D. So the categories extend from almost entirely fatty, scattered fibroglandular tissue, heterogeneously dense, and extremely dense tissue. However, these are not 25% each. It's not like a quarter of the women have one and a quarter have the other. The percentages are the percentages of women that have this type of tissue. So the extremes, the almost entirely fatty and the extremely dense, are only 10% in each, whereas the middle two categories encompass the majority of patients. This is important because the only one, as Dr. Angotti had mentioned, that actually has an increased risk of breast cancer associated with it is the extremely dense group. So only 10% patients are at increased risk because of their breast density. I have examples of each one so you can get a feeling for what it is and how it affects your mammogram. So this is an example of a mammogram of a patient that has almost entirely fatty tissue. You can see that the majority is sort of a grayish black with a few little white strands going through. Some of those are vessels, and some of those are the fibrous tissue, but the majority of this breast is composed of fatty tissue. This would be the next category, scattered fibroglandular tissue. So in this one, there's a little bit more white strands running from the nipple back towards the chest wall, which is the way that they run. And a white cancer might be a little harder to see. This is a heterogeneously dense breast. So you can see there's a little bit more white tissue and a little less of the gray. Is almost the entire breast is completely white. But this is the cancer right here. So it gives you an idea of how the white cancer could hide in amongst dense white tissue. Why am I telling everyone about this? It's not new, but now you're going to hear about it. It goes to the limitations of mammography. Everyone knows that mammography is not perfect. It's the best tool we have, but it is not perfect. And this is just one thing that can limit how a mammogram is interpreted and how we find breast cancer on a mammogram. So it's important for you to understand when you look and have your letter that if you're almost entirely fatty, the chance of finding your cancer is higher than if you're extremely dense. So if you're extremely dense and perhaps at high risk, maybe you want to think about adding something else. So what else is there out there? The newest thing is called tomosynthesis. This is 3D imaging. What 3D imaging is slicing. It's still a mammogram. It's still compression. From the patient point of view, nothing changes. However, instead of having one single image as a mammogram, you have multiple images. 9, some 15, depends on the tissue, how thick the breast is. But what that does is, instead of seeing the dense tissue all piled up on itself, you're dividing it up. That makes that little white cancer that's hiding in there easier for us to see. So it is felt that tomosynthesis is something that will help patients with dense breast tissue for us to be able to seek and find that little cancer that's hiding in there. Tomosynthesis has been approved by GE, which is the group that we use at Doylestown. We have put in our order for it, and we expect to have it in the January, February time point. So at that point, we will start offering tomosynthesis at Doylestown. Breast MRI is considered the most sensitive test that is out there for breast cancer. However, it can have some limitations in specificity. It is definitely related to hormonal factors. So premenopausal patients have a lot of hormonal activity, and that can sometimes be confused with breast cancer and the activity that is seen with breast cancer. In addition, it requires the patient to have gadolinium, which can have some risks with kidney failure. So you have to get a blood test, you have to make sure your kidneys are good before you can have a breast MRI. They also, at this point, are only really covered by insurance if you are at very high risk. So if you are at high risk and you have an extremely dense breast on mammogram, then a breast MRI might be a good alternative for you. Screening breast ultrasound is something that has been looked at for many years. It is definitely something that can find additional breast cancers that are missed by mammography. However, it has also been found that it increases the number of biopsies that are performed and can increase anxiety because there are things we find that we are pretty sure that they're not cancer, but we're not positive. And then we make you come back in 6 months and the patient worries for 6 months that maybe I'm really wrong and I don't know what I'm doing and should I have really biopsied it? I understand all of that. So it is an added test, but it's not a perfect test. So, question, do I still need a mammogram if my breast tissue is dense? The answer is yes. Unfortunately, just because you have dense breast tissue, it does not get you out of a mammogram. The dense breast tissue, the mammography is the only test that has been proven to decrease breast cancer mortality. So it is always the first line of defense, and all other tests are additive. They are in addition to your mammogram, not replacing it. So what do you do? Well, everyone will be getting a letter after your mammogram. You've always gotten the letters. But in that letter now will be stated what your specific breast density is, as well as the categories, the 4 categories that I've seen, so you don't have to memorize that. That chart's on the letter. And then you can know where you fall in the spectrum. At that point, then you talk to your physician who will know your family history and your additional risks and help you to determine if any additional testing would be helpful for you specifically to know to make sure we aren't missing any breast cancers. Thank you for coming. I appreciate your attention, and I hope we've helped you learn a little bit more about breast cancer.